Have you ever looked down at your foot and noticed a bump on the side of your big toe joint that wasn't there before? Maybe it's making your shoes uncomfortable, or you're wondering if it's something you should be concerned about. What you think might just be an annoying bump could actually be the beginning of a structural problem that affects how you walk, how you balance, and even the health of your other toes. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. I've been treating patients with foot problems for over 25 years, and bunions are one of the most common conditions I see in my practice every single day. In today's module, we're going to answer the 3 questions I hear most often. Is this bump on my foot actually a bunion? Did my shoes cause this? And will it go away on its own? By the end of this module, you'll understand exactly what a bunion is, why they develop, and most importantly, why catching them early gives you so many more treatment options. But before we get started, please take a moment to like this video and subscribe to the channel with notification bell turned on. This helps other people with foot problems find this important information. I also post new videos every week with crucial foot health content that can help you or someone you care about. And I've written a comprehensive book all about bunions that I'm happy to send to you at no charge. Just visit www.bunionbook.com to request your free copy. The link is in the description below. Let's start with the basics. A bunion isn't just a bump that grows on the side of your foot, although that's what most people think when they first notice one. A bunion is actually a complex structural deformity. What's happening is that the first metatarsal bone, that's the long bone right behind your big toe, starts shifting outward, away from the center of your foot. At the same time, your big toe begins to angle inward towards your second toe. The bump that you see on the side of your foot, that's actually the head of your metatarsal bone protruding out where it shouldn't be. It's not a growth or a bone spur, it's your normal bone in an abnormal position. This condition has a medical name, Hallux valgus. Hallux meaning big toe, and valgus referring to the inward angling of the toe. But whether you call it a bunion or Hallux valgus, the important thing to understand is that it's a progressive deformity. Now here's something that surprises many of my patients. A bunion isn't just a cosmetic problem. Yes, it can make your foot look different, and yes, it can make finding shoes more difficult, but the real issue is how it affects the way that your foot functions. When your big toe is out of alignment, it changes how you walk. Your big toe is supposed to be the last thing to push off at the ground when you take a step. But with a bunion, that normal push-off pattern gets disrupted. This means other part of your foot have to work harder to compensate. The result? You might develop pain under the ball of your foot, your other toes might start developing problems like hammer toes, and your balance can be affected. Some of my patients even develop knee, hip, or back pain because their entire walking pattern has changed to accommodate their bunion. Now let's talk about why bunions develop in the first place. And I have to start with something that might surprise you. It's usually not your shoe's fault. The biggest factor in bunion development is genetics. If your mother or grandmother had bunions, there's a good chance you inherited the foot structure that predisposes you to developing them too. What you inherit isn't the bunion itself, but rather the foot mechanics that leads to bunion formation. This might include having flat feet, loose ligaments, certain arthritis conditions, or simply the way your bones are shaped and positioned. Here's how it works. As you walk, if your foot mechanics cause you to roll off the side of your big toe joint instead of straight over it, that causes abnormal forces. Your big toe gets pushed towards your second toe, and that metatarsal bone gets pushed outward. Over time, these forces can cause the deformity to develop and worsen. Now, does that mean that shoes play no role? Absolutely not. While shoes themselves rarely cause bunions by themselves, they can definitely speed up the process if you're already predisposed to developing them. Shoes with pointed toe boxes squeeze your toes together, forcing your big toe towards your second toe. High heels shift your body weight forward onto the ball of your foot, increasing pressure on the big toe joint. And shoes without proper support allow your foot to move in ways that can worsen the abnormal mechanics we just talked about. Think of it this way. If you have a genetic predisposition for bunions, wearing proper shoes might delay their development or slow their progression. But wearing shoes that don't fit well or don't support your feet properly can accelerate the process. This is why bunions often seem to appear or worsen during certain life stages. Teenagers might notice them developing during growth spurts. Women often see changes during pregnancy when hormones cause ligaments to become more flexible. And as we age, the structures in our feet naturally become less stable, which can allow existing bunions to progress more rapidly. So how do you know if what you're experiencing is actually a bunion developing? Let me walk you through the early warning signs that I see in my practice. The first thing that many people notice is intermittent redness and swelling around the big toe joint. This might happen after you've been on your feet for a long time or after wearing certain shoes. The area might feel warm to the touch, and you might notice some aching or soreness. You might also start having trouble with shoes that used to fit perfectly. Maybe your favorite pair of dress shoes suddenly feels tight around the front, or you notice that one foot seems wider than it used to be. Some patients tell me they've had to go up a shoe size, but only in width, not length. Another early sign is noticing your big toe is starting to angle towards your second toe. In the beginning, this may be very subtle. Maybe you only notice it when you're looking down at your feet in the shower or getting dressed. You might develop calluses or areas of thickened skin where your foot is rubbing against your shoe differently. This often happens on the side of the big toe joint where the bunion is forming. But it can also occur under the ball of your foot as pressure patterns change. Some people notice changes in how they walk before they even realize they have a bunion developing. You may find yourself unconsciously shifting weight to the outside of your foot or favoring one foot over the other without really knowing why. Now, here's something important to understand about bunion symptoms. They tend to come and go in the early stages. You might have a few days or weeks where your foot bothers you, followed by periods where you just feel fine. This intermittent nature often leads people to ignore the problem, thinking it will just go away on its own. But as the deformity progresses, symptoms typically become more frequent and more severe. What starts as an occasional discomfort can eventually become constant pain that limits your daily activities. And remember, bunions don't just affect the big toe joint. As the deformity worsens, you may develop secondary problems. Your second toe might start curling up into a hammer toe. You might get painful calluses under the ball of your foot. Some people even develop bunions on their little toes. We call those tailor's bunions or bunionettes. This brings me to one of the most important points I want to make. Bunions almost never get better on their own. In fact, they typically get progressively worse over time. I've been treating bunions for over 25 years, and I can count on one hand the number of times I've seen a bunion improve without treatment. The structural changes that cause bunions, the bone positions, the joint alignment, the soft tissue adaptations, these don't reverse themselves. But here's the good news. The earlier you address a bunion, the more treatment options you have available. When I see patients with small early stage bunions, we have many conservative treatments that can slow or stop the progression and provide significant pain relief. For example, custom orthotics can be incredibly effective at controlling the abnormal foot mechanics that cause bunions to worsen. When we catch a bunion early, these prescription shoe inserts can often halt the progression entirely. We can also make specific shoe recommendations and modifications that accommodate your changing foot shape while supporting proper foot function. Simple changes in footwear can make a dramatic difference in comfort and progression. If you're experiencing pain, we have injection therapies that can provide months of relief while we work on addressing the underlying mechanical issues. However, if you wait until a bunion becomes severe, your options become more limited. Large, painful bunions that significantly interfere with daily activities often require surgical correction. And while modern bunion surgery is very successful, it's still surgery with all the risks, recovery time, and costs that it entails. I always tell my patients, it's much easier to prevent a bunion from getting worse than it is to fix a severe bunion that's been ignored for years. The mechanical forces that cause bunions don't take breaks. They're working on your foot with every step you take, every day. Think about it this way. If you take 8,000 steps per day, which is about average, that's nearly 3 million steps per year. If each step is putting abnormal stress on your big toe joint because of poor foot mechanics, that's 3 million opportunities for your bunion to become a little bit worse. But if we can address those abnormal mechanics early, we can turn those 3 million steps into 3 million opportunities for your foot to function properly and your bunion to remain stable. So let's recap what we've covered today. A bunion isn't just a bump on your foot. It's a progressive structural deformity that affects how your entire foot functions. While genetics play the biggest role in who develops bunions, shoes and other factors can influence how quickly they progress. The early symptoms, redness, swelling, shoe fitting problems, and toe drift, are warning signs that shouldn't be ignored. And most importantly, bunions typically get worse over time, but early intervention gives you the most treatment options and the best outcomes. Before we wrap up today, I want to hear from you. Leave a comment below and tell me what symptoms made you first realize that something was wrong with your foot. Was it pain, shoe fitting problems, or noticing the visual changes? Your experience might help someone else recognize their own early bunion symptoms. If you found this information helpful, please share this video on social media. Your simple share can help a friend or family member get the early treatment they need. And don't forget to get your free copy of my comprehensive bunion book. It covers everything we've discussed today and much more. Just visit www.bunionbook.com and I'll send it to you at no charge. If you're experiencing any of the symptoms we discussed today, don't wait for them to get worse. Early evaluation and treatment can make all the difference in your outcome. You can schedule an appointment with me by clicking the link in the description below. Thanks so much for watching today's video. Make sure to subscribe and hit that notification bell so you don't miss the next video in our series. We'll see you next time, and remember, your feet carry you through life, so take good care of them. Thanks so much for watching, and have a great day.